When we're talking about competence and capability, competency is all about, patient safety and ensuring that the practitioner is of a set standard to be able to operate within their sort of designated role. And that is paramount throughout. Competency never goes away, but it's building on that. It's still being able to practice in a safe way, but with the added complexity of the demographic of patients that you will tend to see in advanced clinical practice.
Having a competency framework is really important because it gives the trainees something to work towards, it frames their learning, it helps us plan their training, it helps the supervisors know what level the individual should be working at and what's expected of them when they finish their training. So it's really important to have those things in place so that everybody in the team knows what the roles and responsibilities will be of that ACP and the level that they will be working at the end of training. It's also really important to have that because if you did have a trainee that was failing to meet targets, you can use that as well as a support network to put in remedial measures to help that individual get through their training. In the worst case scenario, if we did have someone that, despite all our efforts, couldn't continue in their training and was not meeting those requirements, it gives us the framework to be able to potentially exit someone from training if we need to.
Gathering evidence against the curriculum is a really good way of finding practitioners who are doing well, finding practitioners in difficulty, supporting those practitioners and ensuring safety and governance, both educational and clinical. So I would strongly advise the use of an effective e-portfolio that not only is a repository for evidence, but also allows cross-linking of that evidence to a defined curriculum, whether that be a local or a national one, and increasingly we've got national curricula.
We have a generic set of ACP clinical competencies, then we have specialty clinical competencies which are built upon that, which are specialty specific. But the supervision around that is built into our original business cases and our original planning for that ACP, and we make sure with all of them that there's an adequate amount of supervision there to ensure that they can get signed off on those competencies and supervised appropriately. And this is where supervision becomes key, because I find you have a lot of advanced clinical practitioners or people working at advanced level practice out there across the country who are academically trained but not necessarily clinically capable. And I think that's where you get the big difference. But you have to think about resourcing them from a supervisor perspective, what their day-to-day working is going to look like, the time of when you're going to get them joining rotas, how that value of that ACP is going to change whether that is premium locum spend, whether that's outcome for patients. All of that has to be thought about.